Well, it's been 2 years since Nigeria and indeed Africa were declared polio-free by the World Health Organization. Dr. Tunji Funsho is the chairman of Nigeria National Polio Plus Committee of Rotary International, and he joins us now. Doctor, thank you so much for joining us on Newsday.
Thank you very much for having me.
It's a pleasure. Good afternoon.
I'm the immediate past chairman. I've relinquished that position now.
Okay, immediate past chairman, completely fine. Thank you for joining us on Newsday. So 2 years after this milestone was achieved, has Nigeria been able to sustain that initial momentum?
Yes, thankfully. We've been able to sustain that momentum. Currently, our mantra is keep polio at zero in Nigeria and by extension in Africa. And so we have continuously been monitoring anywhere that the virus may be hiding by a very robust surveillance system. As I speak, we have an outbreak response going on in 6 states in the northeastern part of the country, which include Adamawa, Yobe, Gombe, Taraba states, also north central states of Benue and Plateau, just to ensure that children are continuously being protected against not only the wild polio virus but also the variant mutant virus, which is what has occurred in a lot of parts of Africa in the last couple of years.
Very good, Dr. Funsho. This robust surveillance system you talked about earlier, is this a private initiative or you're working in tandem with government as well? How proactive is this so far?
Well, the polio eradication effort, it's a joint effort of a group we called the Global Polio Eradication Initiative Group, which comprises government, Rotary, WHO, UNICEF, Bill and Melinda Gates Foundation, and also the Gavi Vaccine Alliance. And of course, we have also local players in the field, which includes organizations like the Dangote Foundation and Saimeko Foundation, a few others who support the initiative.
Great. So, Doctor,
the government is very, very key to what we're doing.
I'm sorry, I thought you were done speaking. Excuse me. So, Dr. Tunji, of course, we are aware that there are other endemics in Nigeria, and I'm just wondering, are there lessons that were learned in ridding Nigeria of polio that could be applied when it comes to the eradication of other endemics?
Yes, we've learned quite a number of lessons, some of them at the beginning and some of them towards the end. I think at the beginning, we didn't, appreciate the fact that when you want to do something good, when you want to have an intervention in a community, you need to ensure that the community understands precisely what the intervention is all about, that it's for their own good, just not enough. But, the fact that, you want to immunize children against the wild polio virus is something that most people don't understand until you actually explain the consequences, of the polio virus infecting their children and what kind of life burden it poses on both, the child who is paralyzed, the parents and caregivers who have to look after. I think we've learned better from that. And we have applied that, for instance, to the COVID pandemic by ensuring that the public is well educated, of the dangers, of the COVID virus, the need to get vaccinated, and the safety and efficacy of the vaccine itself. So we have not had as much resistance COVID vaccination. So that's one great lesson learned. Of course, the other lesson we've learned, is that you cannot shave the man's head in his absence. That governments at every level need to be on board, federal, state, local government. Our traditional leadership needs to be involved. We learned that, in the later half of our effort, because the acceptance of the vaccine, of the polio vaccine in Nigeria, I think we can say, without any doubt, that when the Traditional Leaders Council for Primary Healthcare and Polio Eradication was set up, I think was a game changer to ensure that, the community accepted, the need of the vaccine to protect their children. That was a major turning of a model.
Indeed, Dr. Funsho, and still delving on the issue of prevention, do we still have conditions that could prompt a re-emergence of polio on a large scale, you think, realistically, in Nigeria?
One of our major focus now is to prevail, on the authorities to ensure that we raise our routine immunization coverage. Part of the reasons why we've had resurgence of the wild polio virus, for instance, in some other parts of the world, also in parts of Africa, is the fact that, children who have not been immunized against the polio virus came in contact with the virus in the environment. And part of the reason why the virus will fester in an environment twofold. One, a child that is not immunized or suboptimally immunized, or you have an environment, that is unsanitary, where the virus can replicate, find a new host in a child who is not immunized, and keep circulating in that environment. So those two things are still very present in lots of parts of Nigeria, matter of fact, quite a lot of Africa. So we need to increase our routine immunization coverage to at least about 85%, that all children in our environment are covered, not only with the polio vaccine, but also the other vaccine-preventable diseases, such as measles, diphtheria, whooping cough, and the like. So that is very important. Sanitation also is very important, providing clean drinking water environment. That forms part of the plus in our polio plus. Also, try to ensure that we provide safe drinking water in a lot of the environments that are quite vulnerable because they still drink water from polluted streams and other non-sanitary sources water. So we need to work on those two factors. One, sub-immunization of children. Two, ensuring that the environment is sanitary with the possibility of all households having access to safe drinking.
Well said, Dr. Tunji. So I'm just wondering right now, of all the endemics that prevail in our country, besides COVID-19, if you decided to arrange them in order of scale of priority, which would you have in your top three that we need to attend to sooner rather than later to get to where we've gotten with the polio eradication?
I think one of, I will put on top of my list, diarrheal diseases, because they're ubiquitous, they're everywhere. Again, they're related to unsanitary, environments. Thankfully, we have vaccines for, the rotavirus, which is the commonest cause now. I'll put that on top of our list. I'll also put malaria. Nigeria contributes a significant number of, malarial infections. That's almost 25% across the world. So I'll put malaria next to diarrheal diseases. And of course, we lose sight of the fact that there are also non-infectious illnesses that are ravaging, our people. I'm talking about cardiovascular diseases, which usually is initiated, by undetected rise in blood pressure that is not treated. So those will be my top priority. And of course, with hypertension, we would put, cancers, disease in women, particularly breast cancer and cervical cancer, and in male, in males, prostate cancer in particular. So that would be my priority in terms of, public health, to ensure that we find a way of having the same kind of coming together of government, and non-governmental organizations, putting resources together and ensuring that we reduce as much as possible the morbidity in terms of disease burden and also deaths. These diseases.
Very good, Dr. Funsho. Can you give us more insight? I know you're the past chairman of the polio group within the Rotary International, but what is that group doing to mitigate the effects of polio currently and beyond?
I've lost audio.
Okay, I'll ask the question again, Dr. Funsho. Hopefully you can hear that. What is the Rotary International doing to mitigate a possible re-emergence of polio in Nigeria?
Well, one is to continue to create, awareness, to let people know that polio has not disappeared totally and can easily be re-imported. We've seen that with the importation of polio into Malawi late last year, and as a result of Malawi case, there was an outbreak in Mozambique, which up till this day, today, they have 5 cases. We have one more case, Mozambique last month. So far in Africa, we've had 6 cases in the last 10 months. So when there's polio anywhere, there's polio everywhere. The cases in Malawi was imported from Pakistan, for instance. And in the last few weeks, we have seen cases, environmental cases of polio in New York, causing paralysis, young child. And in Britain, found the virus in the environmental sample. So the important thing is to ensure that we do not allow it to come back, but continue creating awareness, so that people take all the necessary precautions. The important one is raise routine immunization coverage and continue to immunize. Like I said, we are having immunization door to door in those 6 states I mentioned earlier. And we continue to have what we call national immunization days twice a year all across the country, just to make sure that we don't miss with the polio vaccine. We continue to raise funds. Rotary is a major funder of this project. We've so far spent almost $1.5 billion on this initiative, which we normally spend through UNICEF and WHO based on their needs. So funding is very, very crucial. And of course, we need to be in the field, which we are. I'm sure you're going to have images from your team in the field monitoring the exercise of the current ongoing OBR. You see Rotarians there ensuring that we keep a good quality activity in immunizing children, that the vaccinators do what they're supposed to, and use the opportunity also to sniff out any child who may have been paralyzed by polio, and identifying them and make sure that all the stool samples are collected and in good time to see if this paralysis is polio or other non-polio diseases that can cause paralysis. So those are the 4 key areas: advocacy to governments at every level, creating awareness, raising funds, and also being in the field. Make sure that immunization is done and it's done properly, so that we end up with quality immunization activities that ensure that majority of the children we target during these rounds get, the oral polio vaccine.
Well said, Dr. Tunji. So based on where the healthcare system is in Nigeria, are you concerned of more endemics that might be in the works?
Am I concerned about?
About endemics that might be emerging but might not have, plateaued or might have not, hit their peak, I should say?
Well, the only, endemic, disease that will be emerging in different forms is the COVID-19, endemicity, which is what is becoming now. We're having people seems to forget that COVID is still with us. We still need to continue taking those precautions of wearing masks, because those are very easy to do. Ensuring that we sanitize either by soap and water or using hand sanitizers, and avoiding, crowded areas, particularly if they are indoors for a pretty long period of time. COVID is turning out to gradually start becoming an endemic disease. We are not likely going to see the end of it, pretty soon. And so we need to continue to take all the necessary precautions to protect ourselves. Currently, third phase of immunization is going on for COVID. We want to appeal to all, Nigerians, take advantage of get themselves immunized, get an opportunity to get a booster dose, just to ensure that we keep infections, consequences of at the barest.
Indeed, and on that note, we've been speaking with Dr. Tunji Funsho. He's a physician, cardiologist, and former chairman of the Nigerian National Polio Plus Committee for the Rotary International. Thank you for joining us on the show.